I'm Dr. John Bechtel. I'm a board-certified radiation oncologist here at the St. Mary's Cancer Center at JCMG. I grew up right here in Jefferson City, and I'm really happy to be home and take care of any cancer patients in the area right where I grew up. I went to college at the University of Missouri in Columbia. I originally started out in engineering, but as I moved along through school, became more interested in medicine and went to medical school at the University of Missouri also. Then I did my residency at the University of North Carolina in Chapel Hill. Radiation oncologists are an important part of the cancer team. Not every cancer patient sees a radiation oncologist, but more than half of them do, along with the medical oncologists, which give chemotherapy, and surgical oncologists, which operate. We, of course, focus on using radiation to treat cancers. Radiation is, when we use it medically, it's very focused on the tumor, so it's very directed, even much different than like a chest x-ray, which does expose a pretty large part of your body to radiation. The type of radiation we use for treatment is more laser-like, where a chest x-ray is more flashlight-like. It has some direction to it, but not focused like a laser. So one thing is that it's pinpoint, and so that helps avoid healthy tissue. The radiation machine that we have at St. Mary's Cancer Center at JCMG is one of the newest, best machines that they make. It's by a company called Varian. It's what's called a linear accelerator, which is kind of a complicated thing to explain, but it treats with x-rays. Again, they're very laser-like x-rays, very focused, very pinpoint. It does have some very nice capabilities. It's able to deliver what's called IMRT. It's intensity modulated radiation therapy. That's a form of radiation where instead of just using a couple of uniform beams of radiation, you can sort of shape and mold these beams to better conform to the tumor and to better avoid nearby critical structures. The thing that we always have to remember is that when you have cancer, it's going to be a rough time. It's going to be stressful. You're going to be going through a lot of treatment. There are going to be side effects, certainly. There's going to be a lot of information that you have to intake and process. And there's a huge benefit to be derived from getting your treatment closer to home, where your support system is. Your family's here, your friends are here. One of the nice things about the new center is that we're all in the same building. The medical oncologists are literally next door, and the surgeons work in the same building too. And so the fact that we're right there next to each other is going to make that a lot more convenient, instead of having to go, to your chemotherapy doctor's office on one side of town and then go get your radiation on the other side of town. You'll be able to do it all in one trip to the St. Mary's Cancer Center at JCMG.